All right, let me turn the labels on here real quick. Make sure we can see what we're looking at. Your first step today is going to have to be removing quite a bit of skin. We haven't removed anything from the back yet, so you're going to need to remove skin from the entirety of the back down to the gluteal region, but not including the gluteal region, up to the base of the skull. This is going to be a difficult area of skin to remove. And then maybe about halfway down the arm on the posterior side you'll need to remove as well. There will be a significant amount of the lab today. Probably the first 45 minutes or hour will just be skin removal. And as with before, try to remove as much of the skin and subcutaneous fat as possible on the first pass so that you can sort of move on right away and you don't have to spend a lot of time cleaning the fat off of the surface of the muscles. But once you remove all that skin, probably the first things that you'll see quite simply are the trapezius, the large diamond-shaped muscle, and the latissimus dorsi. These two muscles are quite large, and you should be able to identify them quickly. The next step would probably be to identify some of the bony landmarks on the scapula. This will be helpful references for you as you work your way through the work today. The acromion of the scapula at the top, the spine along the back, these are easily palpable if not visible. And then at the inferior angle at the bottom end of the scapula. So take a second and look for those. This will also help you find this triangle right here called the triangle of auscultation. The trapezius, the latissimus dorsi, and the scapula form this triangle where auscultating the lungs is particularly effective. So just a little bit of landmark work up front that I think would probably be helpful. Then the next step is to cut and reflect the trapezius from the midline. I'm not removing it whole like this, but just cutting it and then reflecting it back from the midline. This will reveal the rhomboid muscles. The major will be quite large and the minor will be a little bit smaller, but they have similar paths or similar bony connections. Then by reflecting the rhomboid major from the midline, you'll find the serratus posterior superior, which is officially getting to the intermediate layer of back muscles. You'll probably also at this point be able to find the levator scapulae, which is similar to rhomboid minor in its origin, but instead of attaching to the spinous processes, is more vertical and attaches to transverse processes up higher in the neck. So these muscles are all about in the same area. It's possible when you reflect rhomboid major, this serratus posterior superior might stick to the inner surface of rhomboid major. It's a pretty thin muscle. If you remember from back in Unit 1A, this muscle is a accessory respiratory muscle. It's not a very big or significant muscle. So it's possible this might reflect with this, but if you do have it, it'll be immediately distinctive by its serrated appearance. Then we want to move up into the neck, and this will require that efficient skin removal up in that area. There's two muscles in this area we're going to look for that are deep to the trapezius. The splenius muscles, there's splenius capitis, which is the upper fibers, and splenius cervicus, which is the lower fibers. Together, left and right, they form kind of a V shape. They have very angulated fibers. And then deep to the splenius, we'll reflect that off the midline as well. We're going to see the semispinalis, which is essentially a bundle of vertical fibers that run deep to the splenius. The next step is to reflect latissimus dorsi from the midline. Again, you may find the serratus posterior inferior here, but there's a good chance that when you cut the latissimus dorsi and reflect it, this serratus posterior inferior will reflect with it and it'll be stuck to the deep surface, so don't be surprised if that's the case. If you do happen to leave it down, then you're going to go ahead and cut this off the midline and reflect it, just as we have before, and then that will show us the three muscles of the deep back that we'll find today: the spinalis, longissimus, and iliocostalis. This group collectively forms the erector spinae. So you see this whole back dissection is really all about finding a layer of muscles, cutting it off the midline, and reflecting it, going to the next layer, going to the next. So there's not a lot of worry about damaging structures because the next structure, chances are, will also be reflected from the midline. So you'll pretty much work your way through the same process time and again in the back. At the beginning, you might notice some of these small nerve fibers that are piercing through the muscles of the back. These would be cutaneous branches of the dorsal rami. None of these are objectives. They're innervating the skin of the back. But the one nerve that we do want to find in the back region is going to be on the deep surface of the trapezius. And it's a little bit more difficult for me to demonstrate in this model than it is in your body, because you can simply flip the trapezius muscle over and find it pretty quickly. But what you should be expecting is a pretty long nerve. It originates from the brainstem and then has a long course along the deep surface of the trapezius. It'll be adhered to that muscle, so you'll need to search through the fat to try and find that spinal accessory nerve. That's the back portion of the lab. The second part of the lab turns to the shoulder, and this is a lot more muscle work, just like we did with the back. And reinforce your understanding of the scapula before you go too much farther at this, because you want to make sure your landmarks are clear. But the first thing you should probably do with the scapula is go ahead and remove, there's going to be a pretty dense fascia that's covering this portion, and probably this portion as well, of the whole scapular area. And you'll want to open that up so that you can see the muscles that are surrounding the scapula. These we've already seen: rhomboid, major, minor, levator. These we'll need to identify: the supraspinatus, which is above the spine, the infraspinatus, which is below the spine. There are two muscles called teres muscles. There's teres minor and teres major. Minor is smaller, major is bigger. And then, of course, the deltoid. So this group of muscles is what we think of as our scapular muscles from the posterior. We'll cut the deltoid off of the spine, and at least this portion of it, the posterior and maybe the lateral part, so that we can peel this back and reflect it. And what that's going to do is open up a little bit of space here so you can see the two uppermost heads of the triceps. There's a lateral head and a long head. And the arrangement of this teres minor, teres major, long head of triceps, and lateral head of triceps actually makes some interesting spaces that you can probably see here, here, and here. If I sort of move this around, you might be able to visualize some of those gaps. This space here is called the quadrangular space. This space here is called the triangular space. And this space here is another triangle, but we call this one the triangular interval. So this arrangement of muscles is sort of interesting, that the teres minor is posterior to the long head, the teres major is anterior. So let's turn back to the scapula. Our next goal is to find three sets of nerve and artery that are found in particular places surrounding the scapula. The first place we're going to look is up in the supraspinous fossa. We're going to cut through the supraspinatus and right about here, and peel back the muscle to expose the supraspinous fossa. And what we're looking for here is the suprascapular artery and nerve. And these two structures have a very particular relationship. As they run through this space, they are separated by a structure called the suprascapular ligament, or this is its longer name, the superior transverse scapular ligament. So suprascapular nerve typically goes under the ligament, artery goes over, and then they work their way down around this notch, and then they end up in the infraspinous fossa underneath. So this nerve and artery supply both supraspinatus and infraspinatus. The next pair we're going to look for is in the quadrangle back near the deltoid. This is the nerve and artery which supplies deltoid and teres minor. The nerve is called axillary nerve, and the artery is called posterior circumflex humeral artery. So you'll have to look in this space between the triceps heads and between the teres muscles, and then your clue is that the nerve will actually be innervating the deltoid. The last space we want to look for a nerve artery pair is in the triangular interval. So you'll need to work the two heads of the triceps apart and enlarge this triangle to see these well. But when you do, you'll be shocked at how large the nerve is. This image definitely doesn't do it justice. The radial nerve is quite large. The artery that runs with it is the deep brachial artery, and its Latin name is profunda brachii. So that's sort of the overview of the lab today. As you can tell, it's a lot of muscle identification and just a handful of nerves and arteries. So I hope this lab goes well for you.